seconds or so to let people into the room, and then we'll get started. Okay, hopefully Zoom has had an opportunity to add everyone. We will go ahead and get started. Thank you everyone for joining us. I'm Gregory Phillips with Duke Communications. Welcome to this Duke media briefing on the future of care for young people in this state. North Carolina's legislators have introduced bills in recent weeks that would restrict gender-affirming care for minors and limit how schools can interact with children about their gender and sexual identity. We have 3 Duke experts with us today, a pediatrician and 2 members of the psychiatry faculty, to discuss the potential impact of these bills. With us today is Deanna Adkins. She is an associate professor in the Department of Pediatrics at Duke University School of Medicine and a pediatric endocrinologist at Duke Health, where she is director of the Child and Adolescent Gender Care Clinic. Also joining us is Dane Wicker. He is an assistant professor of psychiatry and behavioral sciences and a clinical health psychologist at Duke, where he provides therapy for LGBTQ+ adolescents and adults. And we have Sarah Wilson. She is an assistant professor of psychiatry and behavioral sciences at Duke, as well as co-lead of the Duke Sexual and Gender Minority Health Program and LGBTQ+ veteran care coordinator for the Durham VA healthcare system. Good morning to you all. Dr. Atkins, we'll start with you. Senate Bill 43 would restrict gender-affirming care for minors in this state. Can you tell us about some of the effects of that bill should it become law?
Yes, certainly. The things that are important to know with regard to this is that this, as a group of individuals, is a small portion of the population. Only about 3% of those who are under 18, and they are a quite vulnerable population. It would limit their access to potentially life-saving treatments that we have excellent evidence within the medical literature that this helps these patients in many ways. It decreases their suicidality, it improves their overall mental health, and decreases self-harm as well. In addition, this is a rigorous process that the kids go through if they are under 18 with regard to evaluation, assessment, and working with their family as well, who are also providing consent for this treatment. So the kids have a number of risk factors that we are really able to help a lot with the care that we are providing, and even in some cases decrease their suicidality to the level of their peers. And this group already, adolescents, it's the second or third leading cause of death is suicide. And so if we can reduce this in this group, we're really attacking an important part of what is taking the lives of our young people. I think that I am quite concerned that many of these kids, if they don't have access to this care or their care is interrupted, will fall back into these high-risk categories. And this includes substance use and self-harm, which are really scary.
Absolutely. Thank you, Dr. Atkins. There's certainly lots to dig into there, and we will do that. But for now, Professor Wicker, I'd like to move over to you and broaden the conversation a little bit. We are also looking at Senate Bill 49, the sponsors of which are calling a Parents' Bill of Rights, which would prohibit any teaching about gender or sexual identity before 5th grade, and among other directives, would also require schools to inform parents if their child is using a different name at school. Could you share some thoughts on the effect that this bill could potentially have on young people in this state?
Absolutely, and thank you for having me. I think ultimately we do not have any evidence that the current practices of, what we provide, the care that we provide, are causing youth to adopt LGBTQ plus identities. And I think that that's a big myth that seems to be coming up over and over. And the other reality that I just want to bring up is there are no interventions or practices that can stop youth from having LGBTQ plus identities. In reality, what these types of bills, the impact that they're going to have is really on concealment, about people hiding really important parts of their identity and then depriving them from the support that they need to navigate through those, really, really critical pieces that affect their health and overall trajectory in life.
Absolutely. Thank you, Professor Wicker. Professor Wilson, I'd like to move on to you. What kind of signal do bills like this send more generally to the wider population and transgender and LGBTQ plus adults?
Thank you so much for that question. There is a high likelihood that this bill, both of these bills, HB 43 and SB 49, would have reverberating effects that would have impacts on the health of LGBTQ plus children and adults throughout North Carolina. We know that from past legislation and national studies of legislation across states, that those who live in states with anti-LGBTQ plus legislation have worse mental health. We also know that when legislation like this that is anti-LGBTQ plus is enacted, that we see declines in mental health among LGBTQ plus individuals. And we've actually seen this in our own state with HB 2 and HB 142. So that's North Carolina's original bathroom bill and its replacement. So there was a scientific 2-year impact assessment on the impact of HB 2 and HB 142. And that impact assessment found that suicidal ideation increased among transgender and gender non-conforming North Carolinians after HB 2 was passed. So it would not be surprising at all. And in fact, it's very likely that these bills will have similar, if not worse, effects and would affect not only the health and well-being of our youth in North Carolina, but also of our adult LGBTQ plus population.
Absolutely. Thank you, Professor Wilson, and thank you all of our panelists for those opening remarks. We will open it up to questions now. Thank you to everyone who submitted questions in advance. You can also post questions in the Q&A window at any time. We have some questions to start us off, and Dr. Atkins, I'd like to come back to you. And one question we have here is, can you talk a little bit generally about what the medical best practices are for transgender children? What options are presented? What are the processes? And how care differs for, say, prepubescent children versus adolescent children?
Certainly. So for those kids who are prepubertal, no puberty has happened yet, there isn't a need for any medical treatment. So primarily the care for those individuals focuses around social transition, changes in how they present themselves to help improve their mental health. And that is an important part of what happens at the school as well, and can really help and decrease the likelihood that they're going to have any issues at school. But for those who are in puberty or have completed puberty, that would be when we would offer the gender-affirming hormone treatment. And then later, as adults, gender-affirming surgeries potentially. But for our young people who are in puberty, who are very distressed with regard to their pubertal changes, and we do see them even self-harm with regard to that, and become very distraught. We may offer an opportunity to pause their puberty. This is a very small population of patients. In my experience, only about 1.7% of my patients would have made this choice in the past. And so we offer this treatment because it's completely a reversible treatment. And we have a very rigorous process of assessment, both with the child and the patient, the parents, as well as their mental health provider, before we would consider moving ahead with that treatment or even gender-affirming hormone treatment. That is the standard of care recommended by the Endocrine Society and the WPATH, or World Professional Association for Transgender Health. Those kids who are post-pubertal would not require those medications, and that is the majority of the patients that present to gender clinics. Those kids are offered hormones that match with their gender identity. There are good data and clinical guidelines with regard to when this is offered. For most patients, they are, in my experience and working with my other colleagues, 16 and older. There are some that are younger than that, that meet criteria of gender dysphoria and have an urgent need to support their mental health because of this distress and would qualify for gender-affirming hormone treatment. And those hormones are used per the protocols of our societies and have data to back that up. And we have lots of evidence that there are lots of improvement in those health outcomes for those patients when they are using gender-affirming hormone treatments. Typically, we would wait until they are the age of in their country, or so here, 18, before moving ahead with gender-affirming surgeries. Are the guidelines in the past, but now there is some flexibility for those patients who are really may be at risk of losing their life.
Absolutely. Thank you, Dr. Atkins. And building on that, Professor Wicker, you touched on this a little bit, but I wonder if you could talk about the importance of schools as a safe place for children who are transgender or members of LGBTQ plus communities that may not have a safe place at home, and how important school is for them, and how this bill could potentially impact that as a safe place.
Absolutely. So, I think working with schools has been a really important part of our clinic's practice, and working with the parents to help them advocate for safe environments for transgender and non-binary children, and so or youth, adolescents. So we want to make sure that we are able to get to work with our educators and our principals, administrators, and quite frankly, it's most effective if it actually starts at the top and kind of goes down as an edict across all classes. And things like having a substitute teacher and calling out names. They may call out a name of an adolescent who is not out as being trans, but may not have had a legal name change. So they're essentially outing children in some of these cases. So we really do want to have close partnerships with schools and to keep our children safe.
Absolutely. Thank you. And Professor Wilson.
May I actually piggyback off of what Dr. Wicker was just speaking about? Thank you. So just to reiterate how far these bills depart from prevailing medical knowledge. For example, SB2, bills like this have been met with disapproval by leaders from multiple medical organizations. So the president of the American Academy of Child and Adolescent Psychiatry has spoken out against legislation like this that targets schools and will out children and additionally limit instruction on acceptance around gender identity and sexual orientation that helps peers have a more accepting environment at school. The American Association of Pediatrics has put out a statement against legislation like SB2, as has the president of the American Psychological Association. And furthermore, nearly every medical association in the United States supports access to the type of gender-affirming medical care for youth that Dr. Adkins was talking about. The American Medical Association, the American Academy of Pediatrics, American Association of Child and Adolescent Psychiatry. I won't list them all, but there really is a prevailing consensus in the medical community about the benefits of gender-affirming care for youth and the benefits of openness around LGBTQ plus identities in schools. And there really isn't instruction that is age inappropriate that's happening currently. We don't have any evidence that there is age inappropriate instruction that's occurring currently.
Absolutely, thank you. And to build on that, Dr. Adkins, I'd like to come back to you and wondering if you could talk a little bit more about what research shows about the benefits of gender-affirming care as it pertains to the long-term mental health of the people who are able to get that care.
Well, certainly, let's talk about what kinds of things that they are struggling with. First, 2 in 3 transgender youth or non-binary youth report symptoms of major depression. 3 out of 4 transgender and non-binary youth report generalized anxiety disorder in the last 2 weeks, and that depression information was also in the last 2 weeks. 60% of these individuals are engaging in self-harm in the last 12 months. 1 in 5 have attempted suicide in the last 12 months. They are 2.5 to 4 times higher to use substances and have higher rates of eating disturbance that interfere with their overall health. And so when we look at treating these individuals with gender-affirming care, we find that the rates of suicide are cut in half. The rates of depression, again, reach oftentimes their peers who are not transgender. It's an 80% risk reduction for suicidal ideation even. And when we have parent support and educator support, we improve resilience and have much better mental health outcomes. And with the increased use of these treatments and affirming services, we also reduce the health disparities that can be affecting the youth during their youth and progress into their adulthood. And certainly, as practitioners, we want to reduce all the health disparities that we can for individuals and the population. If you implement anti-discrimination policies, you can decrease the likelihood of unemployment, housing instability, and other health disparities.
Absolutely. Thank you. Professor Wicker, it looked like you wanted to add to that.
I did. Oh, yes, I did. I was, I think one piece of this is that we, as part of gender affirming care, work as an interdisciplinary team, and that it is stated best practice. And so there, if I'm seeing a patient for mental health care, I'm also in communication with people, Dr. Atkins or a pediatrician or an adolescent health specialist about what's going on. And if, talking about suicide and self-harm. So we need this bi-directional feedback in order to be successful in treating these kids. And so I think that is really a kind of like a core centerpiece of best practice gender affirming care, is the dialogue that we have with all of the different providers across specialties.
Absolutely. Thank you. And Professor Wilson, I'd like to come back to you because you've touched on this. We know that youth and adults who are in sexual and gender diverse communities face higher rates of discrimination, bullying, stigma. This might seem kind of obvious, but can you talk a little bit about how laws like this that suppress discussion at schools of these topics actually serve to perpetuate that kind of bullying and stigma?
Yeah, I'm happy to talk about that. So we do know that in schools, when teachers take more proactive approaches, it can have effects on bullying. But I would also like to speak to some of the community effects that we saw, for example, in North Carolina after HB2 and HB 142. I mentioned suicidal ideation, but we also saw that gender identity motivated hate crimes actually increased in the state. So there can be these larger cultural effects of legislation that can really adversely affect LGBTQ plus individuals by normalizing stigma, right? And where there is stigma, oftentimes there is increased violence. So transgender and gender nonconforming North Carolinians also saw an increase in violence after HB 2 was passed. And there are downstream effects of that increased exposure to stigma, violence, and hate crimes, where North Carolinians who are LGBTQ plus reported feeling increased depression and anxiety following HB 2 and HB 142. So this is a group that already faces disproportionate rates of discrimination, harassment, stigma, and these bills serve to potentially have an amplifying effect for these inequities that we already see.
Absolutely. Go ahead.
They also have added, specifically with HB2, a lot of our patients also had physical problems because they were either from dehydration, they were not drinking all day long at school and would have complications from that, or they would hold it and end up having some kidney problems. I mean, it really is linked to so many things. And again, it does come back to this concealment, forcing people to hide who they are, which also has really problematic mental health impact.
Absolutely. One would hope that any human being can understand that not being able to live whatever you believe your authentic self to be is tremendously harming. Professor Adkins, I'd like to come back to you, and I'd like everybody's perspective on this. Obviously, you all are actively practicing with patients, and this news is out there, the possibility of this bill in North Carolina. Are you hearing concerns from your patients about what this might mean for their care? And are you seeing already effects on patients based on concerns about the potential for these bills to become law?
Yeah, thank you for that question. It is definitely something I'm hearing from my patients. Every patient I see in my clinic and through my emails and in Basket have been flooded with, what are we going to do if we can't receive our care? How are we going to manage? I am very afraid. I've had some patients say that I'm really, really struggling to avoid self-harm right now. This is getting worse. I've had some patients leave the state. I've had more than one family decide to leave North Carolina.
Thank you for sharing that. Professor Wicker, Professor Wilson, do you have anything to add from things that you've seen so far in terms of reaction to this?
I have definitely seen significantly, both from parents and from patients themselves, about these new laws, and a lot of questions, because some of them are so broad, especially the House Bill 43. Anyone who in any way facilitates, it's written so broadly that even if gender transition was going to happen, so sometimes we'll plan on like any surgical procedures happening between that gap between high school and college. But we start that preparation process of talking about, what does that look like? What do we need to really reduce your gender dysphoria? Often before 18 years old, even though that procedure will take place after 18 years old. And so it would even block all of the conversations that we would need to have to prepare these. So that's another piece. It's like, is this going to delay my transition? And then that causes immense distress because it increases gender dysphoria.
Absolutely. And I'd like to come back to that point. But before I do, Professor Wilson, do you have any kind of reactions from patients that you'd like to share, or how that's weighed on you?
I actually wanted to highlight some of our national data that we have on this. So in a 2022 national survey, 93%, so 93%, the vast majority of transgender youth that were surveyed were worried about transgender people being denied access to gender-affirming medical care due to state or local laws. So this is something that's, while not particular to North Carolina, very pervasive among youth. They are really concerned about this, not only for themselves, that they may be in states that have these laws being enacted, but for their peers in other states who may be having care taken away that they've really relied on.
Absolutely, thank you. Dr. Atkins, I'd like to come back to you to follow up on this point. Professor Wicker made this point about the costs, the emotional and mental and physical costs of delaying care. Obviously, these bills would prevent these kind of conversations. What kind of long-term costs are there to patients when this kind of care that they are determined to get and need to get is delayed by a number of years through adolescence? What are the kind of some of the long-term problems that can cause?
Well, the things that we see that we've already talked about their increasing issues with their mental health impact a lot on other aspects of your life. If you are so depressed you can't get out of bed, you can't go to school. If you can't go to school, you can't graduate from high school, you can't get a job, you can't get insurance. And there are a number of folks that the longer you put this off, the worse their struggle is with their mental health, and it continues to impair their everyday life. And so, finding the right timing for every person is an individual process. Every child who comes in, or young adult, adolescent, even adults on the adult side, the timing of treatment is based on the best time for that patient. What is their need? How urgent is it? What is going to be the best benefit? And we use our multidisciplinary team in our assessments to really make sure that happens at an ideal time to prevent all of this downstream disparity and issue that come along. And I did want to clarify that, I am primarily a hormone person, but when we were talking about the surgical process, that is an even more in-depth process to get to, even for adults often, with regard to evaluation and care and planning. And it is not something that a lot of our youth are having. It is very rare for people under 18 for this to happen. And I wanted to make sure that was clear.
Sure, absolutely. Thank you. Professor Wilson, I wanted to come back to you. You touched on this earlier with regards to HB2, the so-called bathroom bill back in the last decade. And that's kind of where we get some of our evidence for how laws like these can have some harms. I wonder if you could talk a little bit more about what we know were some of the effects on LGBTQ plus and trans populations as a result of that bill in North Carolina.
Sure, yeah, I'm happy to talk a little bit more about that. So a lot of what we know actually came from a 2-year impact assessment, which I had mentioned. And as I said, suicidal ideation increased among transgender and gender nonconforming North Carolinians, and hate crimes increased. And I also wanted to mention depression and anxiety among transgender North Carolinians also increased. And we saw these reverberating effects throughout people's lives. People also reported delaying healthcare due to these bills, because there was a concern about general attitudes towards transgender and non-binary folks. And as someone who does practice, at the time when HB2 came out, it's really hard to fully characterize the pain and grief that these kinds of legislations cause. It is an incredibly deep pain to know that there are people in the state who want to deny freedom for folks so much. And so just sitting with the folks that I was working with at the time with HB2 in the room, knowing that there was not much I could personally do about that was incredibly challenging as a healthcare provider. And so I know that the community is really trying to come together at this point to to be able to have some level of solidarity and some level of strength in the face of this incredible adversity right now.
Absolutely, thank you, Dr. Atkins. I'd like to come back to you. You've already touched on this, but I think it warrants repeating. You've talked about how the higher rates of suicidal ideation, amongst students that are struggling, with their gender. This is, potentially life-saving therapy that's being provided. And much as it's a difficult topic, I wonder if you could talk about the actual risk to life, through suicide, through self-harm, to some patients who are not able to access this care as adolescents.
Yeah. So this is always hard for me. The youth that are unable to access this kind of care have those rates that are mentioned before, 40 over half, depending on what timeline you're looking at, risk of attempting suicide. And so what I want to point out about that statistic that's important is not just that the attempts, it's that we don't know the number of kids who actually completed suicide. Their families likely didn't know if that they were trans, if they were that if they were struggling that much. They more likely fall in the category of kids who didn't have supportive parents, and we know that supportive parents and teachers and someone in your life is one of the number one things that improves the suicidality and the mental health of these kids outside of the gender affirming treatments that we have. And so just think about that. I mean, almost half of them have tried to commit suicide. How many out there we never knew?
Absolutely. And thank you, Dr. Atkins. I appreciate you being willing to share that. I think obviously it's tremendously important that people understand the impacts here. And to build on that, Professor Wicker, as somebody who's working with schools, working with kids in schools, I'm wondering if you have anything to add to help people understand, what's at stake here in the actual lives continuing for young people that are struggling with this.
Yeah, and I think building on what Dr. Atkins was saying is that we know from research that family support or family rejection is going to be the most impactful piece that comes into this picture when we're talking about the risk of lives. And, so part of what we do is really, if there are, and I would say that I'm making a broad generalization, but there are a couple, I would say, types of presentations that will come into the clinics. And sometimes it is, parents who are very affirming, they want their kids to get their proactive. They may come and try and see Dr. Atkins before Dr. Atkins can actually do anything for them. But they're on the list. The other type is really where often, like if you ask someone to hold up their arm, right, you'll see self-inflicted injury. And the parent is not generally supportive of, gender transition. However, they want their child to stay alive. They love their child enough to stay alive that they're kind of saying, whatever it takes, I don't support this, but I just need my child to be alive, because they've either been through too many hospitalizations or suicide attempts. And so really they're kind of coming in based on desperation. And that's really what we don't want to have happen.
Sure, absolutely. And thank you for Professor Wicker. I know this is, again, a very, very difficult topic. And to build on that, Professor Wilson, I'm wondering if you could speak to something that both the panelists just mentioned, the importance of having somebody in your life who is supportive, and how much of a difference, that can make through adulthood, that somebody has someone who is supporting them in the identity that, that they're embodying.
Absolutely. So we know that the majority of LGBTQ plus youth report that their home is not LGBTQ affirming. So 3 in 5 LGBTQ plus youth find their home to not be LGBTQ affirming. And the rates actually are a little bit higher for schools, actually. So there are more LGBTQ plus youth who find their school to be an affirming place than report that their home is an affirming place. And we also know that 2 in 5 LGBTQ plus youth are living in a community that's somewhat or very accepting. So similarly, the majority of LGBTQ plus youth live in a community that is not accepting of LGBTQ plus people. But we also know that it's incredibly powerful to have people in your life who love you and affirm you for who you are, right? And that's true for folks who are LGBTQ plus, that's true for folks who are not. Right, we know, right, as clinical psychologists, myself and Professor Wicker, that having people who say, no matter what, I will be there for you, I will care about you, just one person can make a huge difference. And sometimes that person is within someone's family, right? So for LGBTQ plus youth, sometimes that person is within their family, and sometimes there is not anyone in their family who is able to do that for them for whatever reason. And for youth who do not have someone who's in their family who's able to do that for them, then a lot of times youth and adults, right, turn to friends, maybe teachers, other people in the community to be able to gain that acceptance and that willingness to support the person regardless of their sexual orientation or gender identity. And I think the issue is, particularly with the Parents' Bill of Rights, so SB 49, we see that there is an erosion of the school's ability to do that. And schools have been incredible in trying to make rapid change to be able to do this, right? I know teachers, right? I'm not a teacher myself in schools, but I know teachers who have tried to do this and have told me that it's made a difference in the lives of their students. And I'm guessing Professors Wicker and Adkins have seen that in their patients. But the issue is when the legislature comes in and dictates to schools that they cannot do that for their patients any longer, and their students, and if a student says to them, I would like to try out a new name, then by law, if this law passes, by law, the teacher cannot do that, right? A school counselor cannot do that. They cannot try out a new name. In my interpretation of this law, they would have to tell the child's parents. And if the student says, I'm not exactly sure, I want to kind of try out she, they pronouns, right? My interpretation of what would happen is that then that teacher or school counselor would have to inform the parents before being able to just call the student what they want to be called.
Sure. Thank you, Professor Wilson. I think, unfortunately, it's all too easy for people who grew up in safe and supportive households to forget how difficult it is if you're not lucky enough to have that. I'd like to remind everybody you can submit questions via the Q&A window. We've still got a little bit of time here, and we've had one come in, Dr. Adkins, that I would like to address to you. And we have a reporter who's been speaking with transgender youth and doctors this month who have said that they fear that if this care becomes illegal for those under 18, that those patients might turn to the black market for medications or treatment or surgeries that were once legally available. Are you concerned about that, and what would some of the effects of that be?
Yes, that certainly is a concern of mine. Getting an unregulated medication, no matter what the medication is very risky business. You don't have any clue what you're getting. Kids are already, when we think about substance use and fentanyl and those kind of medications that people are using as an abusive substance, that could easily be put into any of these medications. So, I mean, that is there are all kinds of things that could be put into those vials or pills or whatever that are dangerous, and their unregulated dosing could definitely cause potential side effects. Having them monitored very closely, like we do when we're caring for these patients, and keeping their levels in the normal ranges keeps them safe from any adverse events from using these medications. So those are my big worries.
Absolutely. Thank you. Professor Wicker, Professor Wilson, I wonder if you got anything to add there about your concern for how, we've talked about concerns that your patients might have about these laws passing, but some of the effects if they become law in terms of how patients might react or how they might end up seeking care as a result of not being able to get it in a legal way in their own state.
Yeah, so I definitely seen patients who have had to resort to obtaining, unknown, kind of like what Dr. Atkins was saying. They don't necessarily know what they're getting, but they're so desperate to actually be embodied in a body that aligns with their gender identity, that they, it could be survival sex, it could be you just don't know where it's coming from. Could be ordered offline, and so we're constantly asking and assessing in our assessments, which we do with all of our patients. What is the history here? What are the barriers to access that you're facing if you are facing access? And we want our patients to be safe. This is definitely a concern of sort of a black market of unknown hormones or not hormones.
Absolutely. Thank you. Professor Wilson, anything to add? Any particular unknowns that you're concerned about you think maybe haven't even come up yet that could be ripple effects as a result of this bill becoming law?
Yeah, I did just want to mention that we do see worse outcomes in general for trans youth who are also a member of a racially or ethnically minoritized group. And we don't yet know the extent to which this kind of legislation would have a disproportionately negative effect on Black and Brown transgender youth. And there is a real concern among the professional community that there may be even worse outcomes linked to this kind of legislation for those who are either Black, Latinx, or low income, those who may not have as many resources to be able to find other ways to seek care, to go to a different state to seek care. It's really concerning to me to think about not only the direct effects for all transgender youth and all LGBTQ plus individuals in our state, but especially those who have other identities that might put them even at greater risk.
Absolutely. Thank you. And I appreciate all of you providing this insight on what is an extremely, extremely difficult topic. We're going to wrap it up fairly soon, but we have a couple more questions to get through. And I realize this too is difficult. There's some uncertainty around this bill. Clearly, there's a lot of support for it in the legislature. Dr. Atkins, I'll start with you, and I'd like all three of you to address this. We've talked about the concerns your patients have. What kind of counsel are you able to offer to your patients right now? Are there questions, I'm sure there are questions you can't answer, but how are you talking to your patients about this, given that so much is beyond your control?
Yeah, we've definitely been having a lot of conversations around this within our team. I think the things that I offer to them are that I'm doing what I can to help hopefully prevent these kinds of bills being passed into laws by just what we're doing today and educating folks and hoping that education and their understanding of what the risks really are here and what the benefits are here will help us get somewhere where we're not putting these laws or bills forward anymore. And then with regard to actual like boots on the ground, what are we going to do? Potentially finding other ways that they may be able to access care. One of the big things that I worry about with this bill is that it talks about being illegal for anyone to provide anything in preparation for transition, which means the things that could help my patients sort of feel better until they got to a point where they might access either gender affirming hormones, or in their time when they're getting ready to access gender affirming surgeries, were things like physical therapy to help their body shape better, vocal therapy to help them safely use change their voice pitch, either lower or higher. All of those things would be taken away with this bill. So even our like intermediary steps that could potentially they might be able to do or use to help mitigate some of this, they won't, with this broad bill, it would be banned.
Absolutely. Thank you. Professor Wicker, I'm wondering, and it seems like an impossible job, but if you can share any of the comfort or counsel that you're trying to provide to some of your patients at this time.
Yeah, I mean, I similarly to Dr. Atkins, I think sadly, since I think I came here around the same time that HB2 was passed, and so it feels like every year there is, part of my job really does feel like really working to ensure that my patients get the care that they need, and whatever that takes. And I just really want people to understand a little bit more about that. I think a lot of parents get scared when they're, kind of might disclose something, and looking at this bill, it's like they're so scared that they might be hiding something from them, maybe for good reason, but they're trying to codify it into law. And so we know that they're early bloomers, they're late bloomers naturally, and this is a really well thought out process that we work on in our team. And when an adolescent is experiencing gender dysphoria, as clinicians, we need to be able to have adequate time to assess and address the child's gender identity and experience, and work with them and their families, even families who are having problems. And the goal of that is to make sure that this kiddo goes through the right puberty. And so puberty suppressants, even though not many people get the chance to use them, really allow us the time that we need to induce a late blooming puberty, where we can work together as family with mental health providers, with endocrinologists, and an interdisciplinary team to figure out what's going to put that child on the best trajectory for their life going forward. Because the repercussions of going through the wrong puberty are pretty awful, and unnecessary medical risks associated with major gender affirming surgeries in the future. It's like bilateral mastectomy. If you're forcing people to delay puberty, or you're forcing pubertal development that could be the wrong pubertal development, they may have to have major surgeries. It could also be unwanted and difficult or impossible. Some of these developments being done, like skeletal structure, your hands, how broad your shoulders are. Even the best surgeon couldn't necessarily help fix that. We also have things like voice pitch. So we want people whose physical bodies to be aligned with their gender identity as much as possible. It also increases, if that doesn't happen, we have risk, we have bullying, we have likelihood of misgendering, which also has negative health effects. So this is really important work that we're doing, and we've been doing it for a long time, and we know what we're doing. So I think that's something I'd like to emphasize.
Absolutely. Thank you. And Professor Wilson, before we move on to a final question, I wonder if you can share anything about how you're talking to patients and people about this potential legislation. I can't imagine how difficult it is.
Yeah, sure. So For any one of my patients over the years, or any of the community partners that I work with, because I do a lot of research with community partners as well. If any of you are watching, I want you to know that I see you, and transgender lives are sacred, and your life is important. And we here believe that your life is important and that you deserve everything, that you deserve to have a beautiful life that you feel good about and you're happy about, and you deserve to grow up and live all of your dreams. And I think it's really important for those who have trans, non-binary, other LGBTQ plus folks in their lives, be those youth, be those adults, to really take this time right now to listen to those around you who might be telling you what they need. And I would also encourage anyone who, excuse me, this is a little emotional for me, anyone who doesn't have anyone in your life, to think about why that might be. Why do you think you can't think of anyone in your life who is LGBTQ plus? Because we know that 9.5% of youth are LGBTQ plus. So if you think there isn't anyone, there is a high likelihood that there is someone who is afraid to tell you. So I just want to put that out there for all of our LGBTQ plus North Carolinians and all of those who aren't LGBTQ plus but want to support those around them.
Absolutely. Thank you, Professor Wilson, for that heartfelt message. We're going to wrap up here in a moment, but I wanted to ask one more question of each of our panelists, and Dr. Atkins will come back and start with you. And I'm wondering if there's just one thing you would share as a takeaway, just for people to remember, whether as they're weighing whether they think this is a good idea, or if they're a legislator who's trying to decide whether or not to vote for these bills. What's one thing that you would really like people to remember as they take away from this event?
Yeah. It's hard to whittle down to one thing, but I guess what I would say is that, gender affirming care is life-saving care with decades of research behind it, and is the standard of care. And it is a multidisciplinary approach for our youth. There are many people involved, including families, with these decisions. And you wouldn't ask me to not practice this standard of care for any other care that I give. You wouldn't ask me to not do what the American Diabetes Association recommends as the best care for my patients with diabetes. And I don't think it's right that you're asking me to do that for my transgender patients.
Absolutely. Thank you. Professor Wicker, a takeaway maybe from you.
Those are two hard comments to follow. I feel the same for all of the patients and all of the community that's affected by these laws. And I hope that the people who are in the legislature, I wish that they could get a glimpse of what it is like when we are able to provide gender affirming therapy, and to see the smiles on our patients' face, to see their grades improve, to see them have friends, to see them engage in activities. And this care really can improve lives. They feel like that they can actually be themselves instead of just a shell, because they've been hiding things for so often. And so it's just a magical experience I feel so privileged to work with my transgender patients and all of my colleagues who provide this care, because we can see the lives that we make better. And that is why I keep doing this and keep fighting for this. So I hope that our General Assembly will consider the joy that they would be depriving these patients and affecting their lives.
Thank you, Professor Wicker. And Professor Wilson, maybe a final thought from you on something you'd like people to take away from this.
Yeah, thank you. There is robust scientific evidence that allows us to anticipate what some of the effects of these bills will be. And based on our knowledge, we can anticipate that these bills are very likely to increase the risk for poor mental health outcomes like depression and anxiety, increase the risk for suicide among not only LGBTQ plus youth in North Carolina, but adults as well.
Absolutely. Thank you. And we'll call it there. Thank you, everyone, for joining us. Thank you to our panelists, Deanna Adkins, Dane Wicker, and Sarah Wilson, for sharing your expertise and your opinions. We'll be back at 1 p.m. tomorrow to discuss police reform, and again on the 17th to address abortion rights and prenatal care. If you would like to be notified about those or any of our other briefings, please email dukenews@duke.edu, or if you're watching on YouTube, just like and subscribe. Thank you very much. Have a great day, and please hug a loved one today, and remember when you do that you have no idea what they may be bearing. Thanks, and have a great day.